Hi guys, welcome to my channel. It's your girl Precious Oyeleke. In today's conversation, I'm going to be talking about what you need to know about preconception care. Because I remember I was having a conversation with a very young lady and she was saying that she does not know what you need to do, that she was hearing the word preconception care for the first time in our conversation. And I'm like, really? Even though I'm like, I was in this girl's shoes some years back in which I never knew anything about preconception care, what it should be, why every woman needs to experience it, and why men too also have their own preconception care, which I have recorded a video about that. But today we're going to be talking to the woman. What is preconception care? What you need to know about preconception care before you're married, and how to prepare your body for pregnancy even while you are not yet married. So the very first thing is that preconception care is the state of healthcare practices and intervention aimed at optimizing women's health before she becomes pregnant. So every intervention or solution provided to help you have a better health before pregnancy, before a child comes into place. That is what preconception care is. You know, you see some women that maybe when they are married and they are trying to conceive for a child, we need to hear them say that they should use more of a certain type of drug or eat a certain kind of food. But let's say you're already prepared, you have the right access to information, you have the right information at hand. Trust me, your child will do better, you will do better, and in the long run, your family will do better. So the very first thing I'm going to talk about is the importance of preconception care. It's for health optimization. It's for you to have a better health. It's for your family to have a better health. It's for your siblings, your female friends to have a better health. So this is to ensure that everybody have the best possible health at hand. I know that health is not just the state of physical well-being. It's the state of physical, mental, social, psychological, emotional. Name anything you think that health can be. That is what it is. So making sure that the person's health is properly okay mentally. Okay, the person needs maybe a therapy is provided for before marriage, because you will see some people that are always waiting for when conception comes in, and then they need to know more about conception care, and by that time it's no longer preconception care, because in conception care your child is already either in vitro or it is already in your hand. Another reason why is because of preventive care, because a woman might have been exposed to sexually transmitted disease in which she has not properly taken care of. So let's say she has been exposed to knowledge about preconception care, she would have maybe taken the provided drugs or done the necessary care needed to, prevent that disease from spreading, or to prevent that disease from affecting the health of the mother or that of the child. Imagine a woman that is already living with gonorrhea, she does not know that she has gonorrhea. Unlike the men, in which they will realize the symptoms immediately or after some times, woman might not know until when she gives birth to a child that is blind, and that's when the doctor now begins to be like, what if this man already has gonorrhea, which is an sexually transmitted disease? But let's say a woman has been exposed to preconception care, she would have dealt with this disease and managed it effectively to prevent, that kind of issue from happening. And that reason is for healthy lifestyle. We want to encourage more women to have a better lifestyle. And if you have a healthy lifestyle, you have a healthy body to carry your healthy child. You have a healthy body to carry about your daily activity, to carry about your activity for yourself, for your family, for your community, and for your nation at large. And there are key points in preconception care. In preconception care, you need to know the family history. What is it that is peculiar to their family? There's some family where they are peculiar to be having maybe issues like lump in the breast at a certain age. Some have maybe PCOS. In some family they have maybe like when they reach their menopause starts earlier, because menopause is, they just say that, oh, menopause starts at 45 to 50. Some might start at 35, some might start at 38. Families differ to one another. So having access to this kind of information, we help you track, okay, what I need to know, what I need to do, because of your body care or your woman health or your health in general. And that thing you also need to know is your personal health history. Maybe there's a medical condition, if there have been a surgery, or maybe there've been abortion or previous pregnancy that the person might not have carried to full term. These things are needed. Another one is physical examination, things like your BMI, your blood pressure, your blood sugar, all these things. I'm sure that preconception, if you are doing your normal body health care yearly or maybe biannually or every 2 years, the person is definitely prepare our body for conception. And that thing is that screening and tests such as blood tests, STD screening, HIV tests, gonorrhea tests, syphilis tests. There are a lot of all those tests that we are supposed to be doing. You might be like, oh, but I'm not sexually active. Not all diseases are collected via sexual intercourse. Some are collected from sharing equipment like HIV, sharing sharp objects, collecting unsterilized blood, all those kind of things. And that is why you're meant to do all this screening and tests before pregnancy comes into place. And that one is genetic testing. This might not really be the case, but in families where there are issues of genetic disorder, where there are issues of maybe Down syndrome, issues of maybe mental disorder, these things can be checked and put in place. Maybe there might be a need for gender selection or sex selection or the gene selection of the child before the child comes into place. Another thing is nutrition counseling. Healthy diet is an emphasis laid on healthy diet. Eating fruits. I did a video on what to eat during pregnancy, the nutritional food, the balanced food or good food you're meant to take in during pregnancy. You can refer to that video to have more knowledge about healthy eating habits. But before pregnancy, you're meant to be eating well, eating fruits, eating food that will help your metabolism. Not every time chocolate sweet. As you're eating your chocolate sweet, also be eating your vegetables, be taking your fruits, be eating, taking healthy water. I call water healthy because it's very, very healthy. And also be taking supplements like folic acid, like folic acid, vitamin C, vitamin E, vitamin B complex. Take healthy supplements, and you should be exposing yourself to the sun because vitamin D is very, very necessary. Not hot sun, but you get what I mean. Early morning sun is good. Taking supplement like calcium, iron, so many good supplements. Do well to refer to your doctor, your pharmacist to have more knowledge about this. Another thing is lifestyle modification. That some women, sometimes don't stop taking alcohol. Some women don't know that they are pregnant until maybe 8 months, 9 months. I remember I used to watch a show on TLC that they call, "Oh, I didn't know I was pregnant." And the lady will be like, "Oh, she just noticed she stopped taking alcohol. She never knew." But until the day she got to the hospital and said, "Oh, you are about to deliver right now." And she's like, "No, my stomach is just paining." "Hey, you are pregnant." So imagine you are in that kind of situation where you never knew you were pregnant until the day you're about to deliver a child. Let's say if you're exposing yourself to alcohol intake, the child might be born with with deformities. But let's say you already know a year before conception or 2 years before conception, you stop the intake of alcohol, you stop the intake of smoking, even safe. Alcohol smoking is not good for your body. Research studies have shown that most diseases or most even sexually transmitted diseases or some diseases that have to do with sexuality are one of the major factors or one of the major risk factors is alcohol intake. So if you are taking alcohol, dear ladies, stop taking it because of your child, because of yourself, because of your health. And that reason and that lifestyle modification is exercise. Some of we ladies are used to sedentary lifestyle. I'm also talking to myself because I love walking on my chair. I can be on my chair from morning till evening, and this is not good. This is not a good lifestyle. So I believe that at least every day, take a 10-minute walk, take 15-minute walk. The goal is to be consistent. Over time, you will build on it. But start LD exercise. You don't have to eat the gym the first week. You can start with taking 10-minute walk. Before you know it goes to 20 minutes. Before you know it, 30 minutes. You can be listening to a music or listening to an audio book or listening to a podcast, a good podcast. Before you know it, you are better to you are better. You are building a healthier lifestyle for yourself. And another thing is that preconception care, you get to know about management of some chronic diseases. What if the person already have? Studies have also shown that ladies from 25 years old tend to have disease like high blood pressure. They tend to have breast cancer. Some tend to have hypertension, typhoid. I know hypertension is one of the highest disorders now among young people. These diseases are no longer peculiar to older adults. They are now even among young adults. So preconception care will make you exposed to these things. So preconception care goes beyond STDs. It goes beyond, taking care of your vaginal area. It goes beyond all those parts. It also goes into taking care of your heart, taking care of your, taking care of your heart, taking care of your lungs, taking care of every part of your body because they are all needed to carry your child to full term. And that one is medical review. You need safe medication. Always seek medical advice. Not just the doctor is my friend. Yes, it might be a friend consulting for you, but might not be giving you all the needed information you need. That is why you need to seek proper medical advice? And are you sure that your vaccination are up to date? There are some people that maybe when you were a child, you need to ask your parents, did they make sure that you collected the proper vaccination? If you are lacking in some vaccines and you can still collect it now that you are old, please do so. Go and collect it. You're not too old to start collecting it. The pain is just for a while, so that you too you can help your child and help yourself. There's some vaccines like tetanus. These are the way yellow fever. These are like regular vaccines that if they are needed to be taken in your country, please do well to take it in the country where you are staying. And there are so many things you need to know about preconception care. Now, saying that not just for you and also for for someone that is not yet married. If you are not yet married, you need to know your spouse preconception care. You need to know your spouse health. Is your spouse in a very good state of health mentally? Is your spouse in a very good state of health physically, emotionally, environmental wise? These are the things you need to put in place, because you can be seeing a healthy looking guy and he might not be healthy looking deep down. Like, his body might not be healthy, but he might be looking healthy physically. So please and please know your partner's health, know your partner's financial health, because really financial health is also important in taking care of your body health. So all these things are important. Emotional health of your partner, psychological health of your partner. Ask your partner, what are his fears? Is he anxious about anything? Is there anything he needs to tell you? And not just start waiting to when you are married. Not man start saying that, oh, I'm actually living in debt. Uncle, why didn't you tell me before we are married that you are living in debt? So these are the conversations you need to ask yourself. Preconception care is about taking proactive steps to ensure that you have a healthy start, for both the mother of the child and the baby of the child. Because in taking care of a child, you need money. That's why your financial health is very, very important. You need to have a very good emotional health too, and your emotional psychological preparedness. Because taking care of a child is not a ball in the park. You need a lot of emotions. You need a lot of management from you. That is why it is necessary to start preparing yourself now for conception, for preconception care, and not just wait till when you're about to give birth, or not just wait till when you're married, or not just wait till when your child is like you're already pregnant and your child is like 5 months in vitro before you start making the necessary preparation for you to have a healthy child. So if you have any other points, you're medically inclined, you want to share more points, please do well to share your valuable resources in the comment section. You'll be helping somebody, or you might also be helping me as I have helped you with the content of this video. So if you enjoyed this video to this point, do well to like. Have you done that? Like the video, share this video to your friend. Just chill a bit. Yeah, go and share the video and make comments down below. I'll see you guys in the next one.